Hello, and thank you for participating in this survey. I am Bobby Gallagher, a BCBA and doctoral candidate at the Chicago School of Professional Psychology. The chair on my research is Dr. Susan Flynn. This research is to help us to determine the social validity of strategies to reduce barriers to reproductive health care for females with ASD and limited language. Just to briefly review what is meant by ASD and LL. So autism spectrum disorder is a diagnosis that includes individuals with a large variety of abilities. For the purposes of this study, we are looking to help those with limited language or those that are nonverbal or have no vocal language. So having limited language might be using just short 1 to 3 word responses or expressions, or expressing simple wants and needs such as I want water or I need to go outside, but they're not able to carry on conversation or not conversational. Some may use an augmentative device, but others may not. And so it depends on the ability or the level of conversational skills. So we're looking for those that would be considered limited language. And so the deficits in vocal language or limited or no use of augmentative communication systems can certainly lead to frustration, and individuals with ASD and LL may also struggle due to other challenges. So there's such as a change in routine. Going to the doctor is not something that happens every day. Additionally, medical visits can show some increases in anxiety in many individuals, but it has also been noted in individuals with ASD, sometimes due to a lack of understanding of the process or the procedures. Not everybody does everything the same way every time. They're asked to comply with instructions that they're unfamiliar with. We don't ask individuals to get their blood pressure taken every day. And then again, there's also physical contact with unfamiliar people, and so a lack of rapport has been built with the individuals within these settings. So some may engage in challenging behaviors that interfere with completing a routine exam, such as engaging in some self-stimulatory behaviors like rocking or flapping, or what we call vocal stereotypy, where they just may talk, non-contextual vocalizations where they're making sounds, or even scripting of language where they may just repeat phrases over and over again. There may be a refusal to comply for a variety of reasons, and we couldn't list them all here. Self-injury, or hitting themselves, biting themselves, where they might engage in some behaviors while in these areas, or while being exposed to all these different stimuli, such as being out of their routine or being in these environments. And then aggression, hitting, biting, or kicking others. So females with ASD and LL and the research behind menstruation. So what we'd like for all of you to know is that in addition to the need for preventative health care, like all of us, females with ASD have needs that may be going unmet if they're not being seen by an OBGYN practitioner. So first, the research tells us that females with ASD have a higher risk of sexual abuse, and we certainly want them to be examined so that we can determine their health, and in this area, if this has happened, we want to look to see if we can help in the areas of increased mood or behavior challenges during menses. Some individuals have found that, or some research, has found that we may increase the behaviors during such time, especially if we're putting demands on someone. And this may or may not be to undiagnosed pain or discomfort related to menses. And in addition, there have been studies to show that some females have an undiagnosed premenstrual dysphoric disorder, which may lead to more mood changes, may lead to more discomfort, and it also may lead to other behavioral challenges such as self-injury and aggression. In addition, research is telling us that there's an increased risk of breast cancer and possible other cancers due to a lifestyle. What we do know is that many individuals with autism spectrum disorder and limited language who are more impaired often are obese. Their lifestyles are very sedentary. They do not take birth control, or they are not sexually active, and they do not breastfeed. And these are all behaviors that could lead to an increased risk of certain cancers. So some strategies that might be effective, and this is what I'm going to ask you to answer on this survey as we move forward. So Which strategies do you think would help an individual with autism spectrum disorder and limited language to complete an OBGYN exam? So the first is to the use of visual supports. And what I mean by this is the use of a picture to depict the sequence of steps that the patient's going to be asked to complete. So upon completion of each step, a picture is removed until all of the steps have been completed. So this really gives the individual an idea of how many steps they're going to have to complete, and as they're kind of coming to a close, when it's going to end. So this method provides a visual of the expectation and how many steps are required until the completion or end of the visit. So then there's visual supports via electronics. Certain individuals certainly gravitate towards electronics more than paper or other visual stimuli. So similar to the supports above, this would be provided instead of a picture that is removed. It would be provided on a phone, a tablet, or other electronic device. And as each step is completed, the pictures are swiped through or moved. They move on. Next is the Premack principle. So with the Premack principle, it's sort of what we call like grandma or mom's dessert principle. You got to eat your dinner before you can get your dessert. So this is providing the patient with a first then. First complete the exam, and then you will receive something. So a preferred item or access to an activity chosen prior to the appointment. So letting the individual know once we get through this exam, we're going to access what it is that they have chosen. Next is social stories, and social stories would describe the process of the exam and the requirements of the patient in a very short story form. One picture per page with an explanation of what's happening on that picture, often presented with some visual cues of some sort. Right, and the story is then read to the patient prior to the examination. It could also be read right in the examination room, but it's a story that tells them what's about to happen. Then there is modeling, having someone model each of the required steps for the patient. Sometimes modeling can be provided in person with an individual conducting each of the steps to the end of the exam. This may be a bit of a challenge during the OBGYN exam, as modeling some of the behaviors that would be required might not be possible. However, modeling might also be provided via video modeling. So an actor might complete all of the steps in a video, and this video would then be again presented to the patient prior to the appointment or even right in the examination room to show what's going to be expected. And modeling might also be conducted right in the exam on anatomically correct models. So both for breast exams and for internals, the doctor or nurse or someone may be able to show the individual what they're about to do on their bodies by showing them on an anatomically correct model. So some other strategies that could be effective and would really like your opinion on would be three-step prompting. So this is a prompting procedure that some individuals with autism spectrum disorder and limited language may have previous experience with. So the instruction is provided. If they don't follow through, a model is provided. If still no follow through, then the patient is gently guided. So an example of this would be, say, step 1, sit on the exam table. They don't follow through. Step 2, sit on the exam table like me, and an individual would actually model the behavior that they're looking for by sitting on the exam table. And then step 3 would be, let me help you onto the exam table with some gentle guiding. And would that be an effective way to do this? So the other, some others are the use of reinforcement for completion of just the smallest incremental steps. And this may have to come with the assistance of a caregiver, where the reinforcement has to be identified. Some individuals may require tangible reinforcement for each step. So often behavior-specific praise, like I like the way you sat on the exam table. However, some individuals may require access to a preferred app on the iPad or an edible. So because of this is so individualized, the caregiver may be the best person to inform the practitioner of the preferred item and the time it may take before moving to the next step. If after putting on a robe, someone has to access an app or the iPad for a brief period of time, certainly the exam may take a little bit longer, but longer and compliant is certainly better than not at all. And then there's non-contingent extinction. So kind of a fancy word, right? But I want to make sure that I can explain this. At any sign of discomfort or act of refusal, ending the exam. So for some, a complete ending and leaving the office to return another day in hopes that each time we'll do more and more and that the individual will get used to the environment and the expectation. So for others, ending it for a moment, taking a break, and returning to complete more of the steps. So this may result in the exam and it may not. It all depends, but we want to build up the exposure to each of the things that we're asking the individual to do. And certainly there is a spot if you would just offer me any suggestions that you think would be better than the ones that I've offered here, or included in the ones that I've offered here. If you think that things need to be done together, anything that you would like to offer to me or to let me know, I am open to that. So please put that in the question. So on behalf of myself, Bobby Gallagher, and my chair, Dr. Susan Flynn, we thank you. So please return to the survey to complete the remaining questions, and thank you for your help in this research study. We couldn't do this without you.